Metabolic Topology is cure-first medicine. Metabolic Topology is predicated on my book. It's intended to be a new chivalric order in the Hippocratic tradition that puts cure first ahead of some of the other priorities, because physicians are tired of being everything to everybody and want to join one of these chivalric orders, something that dozens of physicians have chosen to do all over America, of which you're able to do with a secular business associates agreement with us. You're able to do with a sacrament with us. You're able to do with both. Metabolic Topology is cure-first medicine. Many physicians went into medical school to engage in what's called cure-first medicine. There's very few settings in America where physicians have the ability to provide cure-first medicine, like with every patient every time. We know one of the reasons is that there were, prior to 1910, there were 103 separate medical traditions from 103 separate shepherd tribes of what a good doctor was, of what Hippocrates was. And the two that survived were medical doctors and osteopaths, which were great because they were rooted in medical science, although it was heavily weighted on East Coast schools. There were 2/3 of the medical schools in America were closed down between 1910 and World War II. A stunning fact for a lot of physicians. Now, that was really good for physician reimbursement, but it was problematic for physicians that wanted to practice cure-first medicine. Cure-first medicine is a qualitatively different thing, because the country doctor that went door to door and looked at the whole environment that the patient lived in, looked in the cupboards, looked at the cleanliness in the sink, looked at the cleanliness in the bathroom, and provided prescriptions based on the everyday living of those individuals. For that diabetic that's uncontrolled, for 6 weeks in between those office visits, they're living in a single place, and that place has a kitchen that has a relative cleanliness, has a bathroom that has a relative cleanliness, has a refrigerator that has a relative cleanliness, has a freezer that has a relative cleanliness, has footwear that comes into the house that has a relative cleanliness. There's carpets and floors that have a relative cleanliness. And that tradition of medicine, which is best called Gheuaconter, which is the accounting system unifying quality and finance, which derives from the ancient word meaning to pour on, of which that was a lot of what those physicians did, is they poured cleaning substance you call like Mr. Clean on the floor to clean the kitchen and show people how to clean a kitchen. They would pour like bleach into the sink, and to get all the flies and all the organic matter killed in the sinks. They would have prescriptions for how to remove all of the disease-causing things like the trash can in the house, which is a huge source of microbes that go airborne in your house. Every time you take a trash bag out of a trash barrel, you're spreading microbes that decrease your life expectancy. And so, I happen to be descendant of Dr. Martha Berry Spalding, for example, who practiced this kind of door-to-door Gheuic medicine. She lived next door to Abraham Lincoln. She provided that kind of medicine to Abraham Lincoln, of which she was central in caretaking for him, of which he had a really troubling and difficult life. But she dug into his cupboards and sinks and showed him how to clean his house and clean his kitchen. She also we joke used to pick him up and burp him during the Civil War. But seriously, cure-first medicine includes public health, includes a primary care, a secondary care, a tertiary care, a quaternary care, each of which has a prevention network underneath it. And those systems don't exist. There used to be physicians that went into people's houses and provided that primary care network. Other modern nations still have physicians that do that. That is some of the tradition of the Gheuaconter, of which even a tertiary trained medical doctor can join the Gheuic tradition and find out that you can actually make money in this field of showing people how to cure themselves of disease by eliminating the salmonella in the house, by eliminating the E. coli in their house, by eliminating the Candida in the house. Surgeons can make money in this field with us in the Gheuaconter system because, again, the surgical site infection tends to not originate from the surgeon. It tends to originate from microbes that the patient brings into the operating room. That happens to be the least clean person in that operating room, and the clothes that they come in on. And that field of Gheuaconter, which means to pour on, that's a field of primary prevention, secondary prevention, tertiary prevention. But those are the fields of, like, Louis Pasteur. Louis Pasteur, eradicated disease. Edward Jenner eradicated disease. And we know that a huge portion of how to cure illness is simultaneous pour-on action, whether it's vaccines, simultaneous pour-on action in the form of, really unsophisticated and undifficult things like Mr. Clean are clear ways of killing off disease in whole populations. And physicians can be involved in quarterbacking that, because the next Louis Pasteur could be out there, in cure first medicine. That Gheuaconter system is a accounting system that's different than what your, accountant provides, in your hospital or your clinic today. Because certified public accountants are not medical scientists. They couldn't explain to you who Louis Pasteur is. They couldn't explain to you who Edward Jenner is. They haven't published in a peer-reviewed journal. They're not biochemists. They're not medical scientists. You don't look to them for moral guidance, and so you don't need them. There's not a single patient that comes into your hospital or clinic because of who your accountants are. And again, those accounting systems, it's not their fault, originate from a consolidation of 103 different tribes of accounting systems, of which the certified public accountants didn't come from the horse shepherds. They came from Dutch and British insurance models, of which you describe as pirates. And we don't mean that to be mean. We just mean that, the lowbrow, barber accountants come from, barber insurance. And there is a Gheuaconter, of which there is an accounting system that looks at disease incidence throughout your hospital, throughout your clinic, looks for ways that you can make money on that and eliminate disease at the same time. That's the Louis Pasteur path. That's what so many physicians are interested in doing. You need to do a master facility plan as part of that. You need to put data into that. You need a medical scientist. I happen to be a peer-reviewed biochemist. I happen to be a peer-reviewed pharmacologist. I happen to be the author of Perfecting the Brand American Medicine. I happen to study these 14 separate Aconter systems, which are the behavioral economics that determine everything in Homo sapien behavior. And the Gheuaconter is so clearly the cure first medicine that physicians want to practice and simply don't have a way that revenue is produced and don't have a way that finance and quality are united in that work. And we know, frankly, that Americans want the option of what I'd call metabolic topology cure first medicine. And so, buy my book, Metabolic Topology, join us in our Metabolic Topology Aconter system, and try out our master facility planning around cure first medicine. Because the cure first medicine layout of your hospital, of your clinic, is qualitatively different than how you lay out the hospital, the clinic today. The tradition of how and where you clean the footwear of guests coming into the clinic or into the hospital is one of the primary things. How you clean the air coming into the hospital and clinic is one of the primary things. And, the current accreditors have not been proactive in cure first medicine. And they're simple, inexpensive things that surgeons can do, that internal medicine docs can do, that residents can do in cure first medicine. And you can make money on it. It's billable. The myth that somehow, cure first medicine isn't something the physician can make a lifestyle on. They sure can. We can do it. We work together on it. You need an accounting system that isn't based on and I don't mean it in a mean way, but if you look at the big four accounting firms, they're based in, the Netherlands and in, Britain. America doesn't have a big four accounting firm. there are 14 neurosystem-based Aconter systems, of which are we had those systems before 1910, and they're still there for us to reach out to. In that ancient 19th century tradition of, like Louis Pasteur, that French tradition, that Aconter tradition, of which that was a gentleman that was studied in science and physics, that was also studied, in what you'd describe as accounting. And he didn't outsource accounting to the Dutch and the British as a French scientist, as a French physician. And neither should you. Not at the department level, not at the hospital level, and not at the clinic level. The Gheuaconter system is the unification of cures and dollars spent, of which the things that cure illness and eradicate hospital-acquired infections are qualitatively different than DRGs. And that doesn't mean that they can't be profitable for physicians, because they will. Join us at Profi.me, Metabolic Topology, Cure First Medicine, and order our master facility plan in the Metabolic Topology tradition today.